Now, infertility is an issue that impacts billions worldwide, with a report by the World Health Organization revealing that around 1 in 6 are affected in their lifetime. Well, one reproductive scientist has made it her mission to tackle this, founding a company that helps women struggling to get pregnant. And joining me now is Dr. Helen O'Neill, who's founder and chief executive of Hertility Health and senior lecturer and molecular geneticist at University College London. So very good morning to you. Nice to see you. You've talked, I think, about a silent epidemic when it comes to fertility. Explain what you mean by that. How big an issue do you think it is?
Well, when we look at the global prevalence, when we say 1 in 6, that's a significant amount of people. But when you think about many of the other, maybe less prevalent issues globally that we talk about, they're far more accepted and discussed in public forums, certainly, and they're addressed through medical issues. However, when it comes to infertility, it's this silent taboo still, and many people suffer in silence and many people don't talk about it. And as a result, these things don't get the solutions they deserve.
So what are the main problems? What are the main factors here that are causing this epidemic?
It's multifactorial, really. And when you look at the National Institute for Health listed reasons for female infertility, there's 11 different listed reasons, whether it's anovulatory, ovarian, chromosomal, genetic. But the most prevalent reason why we are suffering from infertility with higher prevalence is that we are simply waiting too late to have children. There's this idea that you can have children up until your 40s, when in fact 86% of your egg reserve is gone by the time you are 30. So there's just simply not enough conversation around the fact that we have a limited capacity when it comes to our fertility, unfortunately. Without scaremongering, it's actual reality. And we need to actually educate ourselves from a much earlier age to know what our own limitations are.
So education is obviously an issue here. On the issue of that short window for being able to get pregnant, what's your view on freezing eggs? Because some women decide to do that, thinking that'll extend the window.
Freezing eggs is an amazing way to offer reproductive autonomy to an individual so that they can actually take control. However, it comes with its limitations, and it should be viewed, especially when people talk about the success rates. Everyone loves to talk about the success rates, or what are my chances of having a baby if I freeze my eggs? And what they have to look at is their own personal circumstances and the quality of the eggs and the age that with which they freeze them. So freezing your eggs at a younger age, maybe in your early 30s, you have a far higher chance of having a successful fertilization of that egg than freezing much later. And unfortunately, the average age for freezing eggs is around 39, 38, which is just far too late to be freezing eggs. And it's just unfortunate because they're then misled into thinking that this is something that they've done that will guarantee them a future baby, when in fact, they spent a lot of money without that assurance.
And does the same go for IVF?
The same is, of course, true of IVF, and you also have to think about the other 50% of the DNA which will contribute to an embryo, which is from the sperm. So egg and sperm health are really important when it comes to factoring in success rates.
So you talked about education and people needing to know the facts about how much time you've got and when is the best time, perhaps, to try to have a child. Do you think the NHS should be doing more, though, as well, in this whole area?
It's one of the things that we get asked as a company that provides fertility tests and a full overall reproductive health assessment. People say, well, surely I can just go to the NHS. And unfortunately, what we believe is that proactive and preventative testing will save people the need for fertility treatment, or at least help them uncover the causes why they're not getting pregnant. But the route to treatment through the NHS, unfortunately, requires them to wait 12 months at least, and it doesn't stratify them according to maybe some of their symptoms or underlying pathologies. So we actually did a large study looking at all of the care commissioning groups on the NHS and looking at the referral criteria. And we actually saw that nearly 70% of individuals will never be eligible for NHS-funded treatment. So this is something that's very profound when you think that patients are going and being told to wait and come back a year later, when actually time is the most precious element that you have. And after that year, then coming back and not being able to be referred is actually quite tragic.
So what do you think needs to change?
I think everything needs to change, from the conversations that we're having, the provisions of help within the workplace. The majority of reasons cited that women say they haven't decided to have a baby is work-related. You know, there's a fear to come off the corporate ladder or to deviate from careers that we worked very hard to achieve. And so Obviously, another reason is finding a partner, but when you're working 24/7, it's difficult to separate out our lives in the way that they were much more readily separated even 10, 20 years ago. So workplaces need to be supportive of reproductive health, of providing additional screening. We go into workplaces, we provide educational lunch and learns about some of the most fundamental aspects of harnessing hormones, managing menopause. These are things that everyone in the workplace should already have received an education about, but hasn't, and so we provide them along with testing.
And am I right in thinking that a number of you have had children since setting up the company, and there's a lot of children around in the office?
Yes, that's right. I don't believe that having children should be an either or. I think that having children should be the thing that inspires you. It certainly inspired me.
So a chaotic workplace sometimes, if there's, or is it just help the atmosphere?
I don't think there's such thing as a non-chaotic workplace when you're trying to build something as profound as what we're building.
That's a very good point. Dr. Helen O'Neill, really interesting to talk to you today. Thanks so much for coming in.
You're welcome.
Let's take a look at the weather now.